Welcome to North Star Physical Therapy Podcast. I'm Dr. Shirley North, and with over a decade of clinical expertise in the areas of pelvic floor conditions, lymphatic conditions, and chronic neurological diseases, I have a wealth of medical knowledge that I want to share with you all. In this podcast, I will answer the most common questions I receive from clients, family members, and fellow clinicians. Our purpose is not only to answer questions, but to educate you so you can make the best decision for your optimal health. This podcast is perfect to listen on your way home from work, while you're on your daily walk, or just taking 15 to 20 minutes for yourself. Again, welcome to North Star Physical Therapy Podcast, and get ready for us to guide you to optimal health. Hi everyone, and welcome for those who are new, and welcome back for those who have listened before. And thank you so much for your support here on North Star Physical Therapy Podcast. Today's episode is an episode that I've been kind of holding out a little bit on discussing because it is starting to become a much newer topic, much investigated topic, especially in the world today, and especially within my two specialties of lymphatic health and pelvic health. And that is the discussion wrapped around GLP-1 use within this population, and what are the side effects, and what do I see as a clinician, and recommendations, and all the things. So this might be a little bit of a longer podcast, just forewarning there. And there might be part 2 and 3s, who knows? But just wanted to open up that discussion and open up your mind to potentially considering at least a conversation with your primary care, your gynecologist, your functional medicine provider, some sort of hormonal health provider for this. And so specifically speaking, to those that are possibly perimenopausal, postmenopausal, potentially have pelvic health issues, and for those, again, who are suspecting or diagnosed with lipedema. So one thing that we want to try to help dispel a little bit is GLP-1 and GIP are medications that are becoming more and more well-known, that are primarily used right now for their on-label effect on diabetes and overweight. And what we are now seeing, and this is why I kind of held out a little bit, because there was a webinar that I recently participated in looking at the latest and greatest research with these medications within this client population. So I wanted to see what the latest research was, and then be able to kind of present more accurate information. So when I say latest research, I literally mean within the last 3 to 4 years, right? So this is still very, very new stuff, and there's still ongoing research happening, which is really promising and very exciting. And so what we often think about is Ozempic and Mounjaro. Those are two of the quote unquote older ones. Those are the GLP-1s that we are often associated with, those with the higher side effects of that nausea, vomiting, loss of muscle mass, things like that, that just really gets advertised out there. What we want to look into, and the more medications that are coming out, specifically like the GLP-1/GIP, those are things like Zepbound and Wegovy. And I'm saying the more popular names because there's the semaglutide and trizepatide are the other names for them. But just for pure popularity's sake, we're going to go with Zepbound and Wegovy. What we're frustrated is that sometimes these medications, aren't covered by insurance, but they are hopefully here soon, going to be turning 10 years old and flipping to generic and be able to be a little bit cheaper. There are companies, especially Zepbound and Wegovy, that understand that there are more beneficial effects that are that people are reporting and seeing in their health and wellness, that they're offering all sorts of coupons and things like that to make it a little bit more affordable for people to pay for it out of pocket. It's still not fantastic, with everything else raising in prices and such. But for example, Wegovy has an injectable and a pill form, and their pill form, I believe, is about $150 a month with their coupon on their website. So it's better than like $1,000, that your insurance won't cover. But it's something rather than nothing. All this to say, I am not a prescribing provider. I have no affiliation with these medication drugs. What I'm here to say is, like, what are things that we're seeing with these medications within pelvic health and lymphatic health that may warrant at least a conversation with your medical provider. So GLP-1s and GLP-1/GIPs, what's the main difference? Those Zepbound and Wegovy, they tend to have less side effects. We still want to make sure they're monitoring, nausea, vomiting, diarrhea, constipation, but they tend to have like better weight loss and metabolic control than the GLP-1 by itself, like Ozempic and Wegovy. So it's just like less severe side effects with the same effect. And so they're what we call dual action medications. And also the latest research is trying to potentially come out with a triple action medication that may lower those symptoms even more. So fingers crossed for, what's to come with medicine. But we also say, if you're utilizing these medications for any kind of weight loss, because for those with lipedema, they tend to have these really fibrotic adipose tissue, that there's this almost like this chronic inflammatory process going on, and therefore that's why they feel like the heaviness, the swelling, the fatigue, all those, the pain, all those kind of things. What I'm finding is that, kind of anecdotally, but it's just quite interesting, that when I have a client that's on a low dose GLP-1 medication, in addition to exercise, in addition to nutritional intake considerations, these medications give a little bit extra support to the metabolic system, a little bit extra support, and almost like an anti-inflammatory effect, so that the symptom of the lipedema is reduced. So they are able to do more exercise. They can be able to be less fatigued and participate in more family and friend activities. So we want to say this, like, it may be something worthwhile to discuss to see if medically it's appropriate for you to at least trial these very low dose situations to see if you can help with the side effects of those with lipedema. Not everybody that I see with lipedema has them, but not everybody who's on the medication has lipedema either. Okay, so, but I just want to say, like, I think it's worth looking into. And when they say muscle loss, they're really talking about the muscle that's kind of more superficial, and that the fat has infiltrated that muscle. And that's what happens within lipedema. Underneath that is the lean muscle mass, right? So when they're losing muscle mass, they're sort of losing that fat infiltrated muscle mass, because it's the fat and inflammatory process that's being reduced, not necessarily like muscles be taking away. So hopefully that makes sense, that it's like the total mass, the total amount may go down, but the lean muscle mass underneath everything isn't really touched. However, we also know that if you don't use it, you'll lose it. And every year after the age of 35, especially in women, we lose about 2% of our muscle mass strength. So we need to continue with resistance training. When we say resistance training, we don't mean you need to go out and be a CrossFitter and lift super heavy. We want to make sure there's some level of resistance, and like against body weight, or yes, for lifting, using kettlebells, resistance bands. I often see within the lipedema population, as I spoke about before, that we see a lot of what we call hypermobility. And so we really want to have a good prescriptive exercise base of what good resistance training looks like for someone that has really hypermobile joints, so we don't hurt ourselves. Kind of case in point, I am hypermobile. I was just in the gym this morning. I purposely lowered my weight to have better form so I didn't hurt myself. And talking with my coach, and my trainer, like, hey, watch me do this so I'm not doing something stupid. But we're also utilizing good prescriptive repetitions, prescriptive weight, prescriptive positioning. So that's what physical therapists really specialize in. We do want to say exercise is medicine, and there are prescriptive exercises for that. So it goes hand in hand with this medication use to help with maintaining and building lean muscle mass, while these medications are helping to quiet that food noise to help with any kind of stress eating and things like that, helping with better metabolic rate for that digestion. However, with that, we often see the side effect of constipation because it's slowing the gut motility, right? So it's making you feel fuller because it's kind of slowing down the movement of the bowel for that. So if you tend to err on the side of constipation just normally or naturally, we definitely want to beef up the constipation management strategies, and that's what I screen out for when everybody's on a GLP-1 or GIP, that we're asking those pelvic health questions, because that could be a side effect, or they naturally kind of are, tend to go that way with stress, or with the change in cycle or things like that. We want to help manage that anyways. And then especially, okay, what are some things maybe we can adjust so that we're less likely to get constipated on these medications. The less side effects, the better consistency, the better use of things. We're all working together. So that's where we want to make sure, with PTs being involved with that prescriptive exercising, that we're factoring in, the not just the muscles themselves, but the tendons that connect the muscles to the bones. And so sometimes that inflammation process that's going on within the lipedema community can affect those tendons. And so we want to make sure we're looking at how much load, you're doing, what position that you're in, where there's different load factors on joints and tendons that can potentially make things worse or hurt. And so getting a PT involved whenever we are placed on a GLP-1 or GIP is absolutely critical. We also see that these GLP-1s and GIPs, that there is actually better bone health, that it helps increase the bone forming cells and helps reduce the bone degradation cells. And so what we talk about that is like within the osteoporotic community, where bone is degrading faster than bone forming and becoming stronger. So it kind of like weakens the bone. Well, bone health is so huge for perimenopause and postmenopausal women specifically, and anybody with any kind of like joint stress and arthritis, right? So what we're finding is that these GLP-1s and GIPs are actually helping bone health, helping increase bone formation. So that's very exciting. We see, actually like a reduction in that metabolic inflammation that we see in arthritis, that we see in diabetes, but that we also see in lipedema. It helps reduce that abdominal fat that often gets laid down within the perimenopausal time frame, because our hormones are changing, and it's like cortisol is increasing, estrogen is like wait, and it lays down that visceral fat. So we see that visceral fat reduction, and that definitely helps. And with the especially like with that, to kind of help correlate that with like obesity, for those that are deemed obese, there's an increase in circulating estrogen, because the body doesn't know really how to get rid of that visceral fat. Within that fat, it's all that estrogen. And so when we're reducing that visceral fat, there's less circulating estrogen, which is helpful for those with lipedema who naturally have this increased estrogen. More estrogen doesn't always mean better. I often have that metaphor of like estrogen is like a fertilizer, right, to tissues. So like when we need it to happen within their body, like during pregnancy, or like during our menstrual cycle to help beef up, the lining of the uterus and like things like that. It's like that's where we want it, but it needs to be regulated by progesterone. And progesterone is kind of like if the lawn, so to speak, is being fertilized by estrogen, where the progesterone is like the lawn mower. It just kind of helps keep it in check a little bit. And but when we need it the most is when we're pregnant, and when we're building up that line in the uterus during our cycle. So when we need it, it's there, but then it does like fluctuate down. And so when we're in this perimenopause and postmenopausal phase, progesterone is down, estrogen is down. Great. What we often see within the lipedema community is that estrogen progesterone balance is like so out of whack. And so actually to try to help control that cattywampus hormonal level, it's almost like a hormonal medication as well. I wouldn't qualify it as like hormonal replacement therapy. I think it's just a helpful potential alternative to discuss with your primary care provider, gynecologist, whatever prescribing provider for medications for you, of potentially helping with that hormone regulation, so that we have those less side effects of that perimenopausal time frame that is often associated with estrogen and progesterone being out of balance. For example, if you're having like difficulty with sleeping, if you're having that visceral or abdominal weight increase, if we're starting to get a little bit of like the kind of hot flash or just being a little bit like warmer, and if you're starting to, or like the cog fog, if you're starting to see these things consistently over the month, over like a 3 to 4 month time frame, despite what's going on with your cycle, you want to at least start talking about these things. These could be these like slow signs, like how your anxieties are and things like that. These starter symptoms that things are starting to change a little bit. What is something we can help support your system a little bit better so it's not such a drastic up and down? And this is where maybe a microdosing of a potential GLP, GIP-1 to help reduce that circulating estrogen that might be throwing things out of balance could potentially help. I have a lot of clients on GLP-1s or GIPs that maybe have to come off during pregnancy, and then they work with their provider to slowly kind of get them back on afterwards. Those people that are also going through pregnancy, for example, I have a client that has gone through her second pregnancy while being like on a GLP-1 GIP. She has pelvic health conditions. She also has lipedema. And so what we discovered that when she was off the GLP-1 GIPs and with the fluid overload of the pregnancy, it kind of exacerbated some things, and we wanted to make sure we managed that throughout her pregnancy, and then managed her getting back on to the medications to help with that inflammatory process that was going on, and to help like flush the fluid out, help reduction of the pain, those kind of things, so that way she can participate in taking care of her kids and being on her feet and doing these things. So I say all this to say, if you are interested, at least continuing that conversation to see if it's medically appropriate with your provider about GLP-1s and GIPs, and see if it's appropriate for you. I think it's great. There are so many studies, like right now, just speaking on those little statistics that I just mentioned with this short little podcast, that it's more than just for like quote unquote weight loss. Right? It is a potential anti-inflammatory. It helps to reduce the like circulating levels of estrogen. It helps with bone health. We are noticing that coupled with good nutrition and exercise, that we can have a good prescriptive, exercise with that. But it really does help make a safe, gradual weight loss plan that is sustainable, and that can really help with joint health, with cardiovascular health, yes, with bone health, with soft tissue, with the cog fog, right? There's that natural endorphin release once you're more active in doing things. So there's more than just a weight loss pill, and it's not the end all be all. You have to be doing these other things to help reduce those potential side effects of the GLP-1s and GIPs. I often find that people that have the worst side effects is because that's all they're doing are these injections or the pill, and that's it. And as I know, our body doesn't work in silos; it all works together, and we have to do more than just one thing. And so oftentimes with that, though, a side effect too, like I mentioned before, is potentially, nausea and constipation. But we also want to make sure we're screening out any other kind of pelvic floor dysfunction. And with that, though, if anybody had any like overactive bladder symptoms or stress urinary incontinence symptoms, potentially, yes, some of that weight loss can indirectly improve those symptoms. There's less pressure on the pelvic floor and on the bladder when we're losing some visceral fat. So it could help with those things, but it's not the end all be all. You still need to be assessed and treated by a pelvic floor therapist because there's so many contributing factors to those overactive bladder or stress urinary incontinence, and we want to make sure we're solving all of the contributing factors. What we also see is that it helps with the potential like sexual dysfunction, where sometimes there needs to be that communication between the brain and the body, right? And so when there is a GLP-1 on board, that tends to what we call vasoconstrict. It tends to reduce the blood flow. And so there could be potential signs of erectile dysfunction for those that have a penis, could potentially reduce orgasms because the part of the brain for that food noise is also the part of the brain for the libido. So was there some of that before the use of the medication? Maybe. If so, we definitely want to get treatment on that. Was that a side effect of the medication? We want to try to help screen that process out. But if no one's asking the questions, we don't know. There is this condition called PGAD or PGAD, and that's almost like this overactive orgasmic sensory condition that is like just is so constant. And for some people, like, ooh, that's great if I have orgasms all the time. It is not, and it's exhausting, it can be painful. It is very hard. So when you have somebody that has PGAD, it could potentially help because it's helping with the center and the brain to help reduce that input from the brain onto the clitoris on the glans penis. And so there could be a potential secondary assistance with those with PGAD for the use of GLP-1s. However, there is this condition called Ozempic vulva. I hate these things, but it floats out there in the public. And so what this is referring to is a thinning or a sagging of the vulvar tissue. Now, is this because of the GLP-1s, or is it because a lot of people who are getting on GLP-1s are also in perimenopause and postmenopause? And was it a side effect of the tissue changes related to the hormonal change of that? Or is it really truly caused from the reduction of that fat tissue, and therefore that skin is just sagging a little bit more? Again, things to problem solve with between you and your provider. What we have seen is with those that have pelvic pain, that there is this a reduction of that pain sensitivity, that with the reduction of that adipose tissue, that inflammatory signal is then reduced. And so just with pelvic pain. So think of like endometriosis, adenomyosis, mast cell activation, lipedema. I have so many people with pelvic pain, and it's like, as we're going through the musculoskeletal things, as we're going through the nervous system regulation, as we're going through orthopedic issues that could potentially be giving rise to this pelvic pain, I always kind of keep in the back of my head, hey, maybe it is something to talk about. If it is this like inflammatory process, is there something medically to discuss with your provider of potentially doing a microdose of GLP-1 GIPs, see if it's appropriate. So I wanted to also plant that seed that even within pelvic health, there could be potential benefits with GLP-1s and GIPs. So I'm very excited for this kind of newer research coming out within the last couple of years. More is definitely needed to come out, and randomized controlled studies and things like that definitely need to continue in this area. But you can't help but to think there may be more client populations that these medications can help support those symptoms that are limiting them in their activities of daily living, in their sexual lives, in their ability to participate in family and friend, activities, in order to just not have to live by a bathroom or have to just be gaslit of being like, just use lube for your pelvic pain. It is very promising, especially for those with potential like endometriosis or adenomyosis, that we could potentially have another medical intervention in the back pocket, in addition to doing the other things that we do for that. So I'm really excited to kind of see over the next 5 years or so what other research is going to be coming out, therefore proving our case to submit to insurance and say, hey, you need to cover this for this too, for my pelvic pain, for my chronic inflammation because of this other systemic condition that I have, that these GLP-1s and GIPs may really start to kind of have a place. I'm going to kind of quote my primary care provider. I purposely become the last client for her for her day because we ended up chit-chatting about stuff. But I asked her about GLP-1s and GIPs as a primary care provider who also specializes within women's health. And she's like, you know what? I don't want to put my hat on any one medication, but if any medication that has come out over the last decade that really shows a lot of promise in multi client populations and for multi-use at a very low dose and has its wiggle room to, of course, increase doses to help for folks, GLP-1s and GIPs are kind of that medication. So again, more research is needed. But if your provider that prescribes medications within this space, hormonal health, functional medicine, gynecologists, primary cares, if they are still hanging their hat that GLP-1s and GIPs are only for those who are overweight or only those that have diabetes, and they only know Ozempic and Mounjaro, you need to find a new provider, okay? I'm happy to help, with that advocacy that our medical providers need to also stay on top of the latest and greatest research. If I'm able to do it as a physical therapist, they can too. More and more research is coming out, and they need to be aware of Zepbound and Wegovy and other things, and to maybe open their eyes a little bit to considering other uses for them. Also educating of what's appropriate for you based on any other medical conditions you may have on board, or any kind of family history to be considered of, like gallstones or kidney stones or constipation, or things like that, just to make sure it's a beneficial thing for you. But if they're still in the old school and talking about Ozempic and Mounjaro, and they're not as knowledgeable as this for Zepbound and Wegovy for other potential uses, but educating you of what's going to be covered, what's not, but also helping and advocating for you, looking up Zepbound and Wegovy websites, or GoodRx, and things like that may have a coupon or something like that for you to try. Also for them to be able to monitor if the deem that you're appropriate for it, or at least for a trial, that they are following up with you on a monthly basis, and especially on a quarterly basis. And for that weight loss, we don't want to have any more like 1 to 2 pounds a month, really, for the weight loss. With adding on these medications, because you should, again, still have nutritional considerations and exercise going on. And so if you're losing too much weight too fast, that can be detrimental. So it is a little bit of a slow go, because you don't want to have that much change on your system. It can be like, whoa, what's going on? So a good provider will be knowledgeable in these things, and a good provider will also be able to monitor you as you trial it. So planting a massive seed on everybody's head of being an advocate for yourself. Ask your provider, see if it's appropriate for you. If you are placed on a GLP-1 and GIP, you absolutely must consult a pelvic floor physical therapist. There are definitely screening tools that we utilize and assessing, so that way we can be taking care of any contributing factors that may have been underlying some of these side effects. So that way your transition with these medications are smooth. Because a lot of people that tend to be starting on these medications may have already had some hormonal changes starting to happen, and they relate it to the medication instead of like what their body was naturally doing. So we want to make sure that you're getting seen by a pelvic floor physical therapist. For those with lipedema, that your lymphatic therapist is well aware of these things as well, and that can potentially refer you to a pelvic health as well. And if you don't have prescriptive exercise, if you are on these medications or considering it, we want to make sure that you're hooking with a physical therapist that understands the tissue changes and the tendon challenges and the muscle mass, resistance training, all of those things to give you a good individualized prescriptive exercise program. So again, the transition with these medications and continued, weight loss and that body composition change is in the positive direction, not in the negative. So a lot of good things on this podcast. There will probably be another one here shortly. There's just so much to share. But I just want to kind of come out there with the latest and greatest research that I found with these different client populations that some of this stuff may be appropriate for. It's worth a discussion with your provider, and it's worth hooking in with the pelvic floor PT. And so, again, until next time.
Thank you all so much for listening to North Star Physical Therapy Podcast. Continue to follow me on Facebook or Instagram at Dr. Shirley North. Check out my website at www.northstardpt.com, or I encourage you to email me any other questions about these topics, and it can be featured at a future podcast at snorth@northstardpt.com. Again, thank you all so much, and thank you for letting North Star Physical Therapy be your guiding light to your optimal health.